Yeah, well, Health Commissioner Dr. Manisha Juthani says the virus is typically spread through close skin-to-skin contact, and those who are diagnosed typically have relatively mild symptoms. Now, she says with Connecticut's first case, that person was stable enough to isolate at home. Monkeypox detected in Connecticut.
The clear message right now is that the risk to the general public is pretty low. We do need to be alert and aware.
A man in his 40s from New Haven County, the first detected case in the state. According to the Department of Public Health, we're told the patient is in isolation and has not been hospitalized. Officials could not say where the individual contracted the virus. Health officials say monkeypox can spread through close skin-to-skin contact with an infected person for a long period of time, or prolonged respiratory close contact in some cases.
If you have an unusual rash, if you have been exposed to somebody who's had monkeypox, if you've traveled to a country where monkeypox cases have been identified, these would be things to be worried about. In terms of the general population, I don't think you need to be overly concerned.
Some of the signs of infection include fever, swollen glands, and a rash. Dr. Juthani says testing is primarily done by swabbing a lesion and sending it to the state public health lab. In a statement, Health and Human Services Secretary Javier Becerra said, "We are working around the clock with public health officials in states and large metro areas to provide them with vaccines and treatments to respond to the current monkeypox outbreak." Dr. Juthani says vaccines are available for people in Connecticut who are doing testing and for people who have had close personal exposure to an identified case. Now, the federal government has ordered more than 4 million doses of the vaccine to respond to the monkeypox outbreak, according to HHS. We're live in Hartford tonight. Alicia Machado, Fox 61 News.